Greetings, I am Emiliano Zanier, osteopath and physical therapist. In this short video I want to show you the protocol using the paper A Multidisciplinary Approach to Visual Disorders During Pregnancy through Hypnosis and Osteopathic Manipulative Treatment, a case report. The techniques arise from the world of osteopathic treatment, and in the paper you can find the entire reference to the book or to the paper for each type of technique. The first technique used in the paper is an indirect technique for the treatment of the diaphragms. The first diaphragm is the pelvic diaphragm. I put my upper hand on the pubic bone and the other hand lies on the sacrum and on the coccyx. We use a gentle compression to obtain a sort of start for the indirect technique. The technique is a relaxation of the tissue between the two hands and lasts 2-3 minutes or until the tissues has been relaxed. The second diaphragm is the thoracic diaphragm. We put the hands in the dorsal-lumbar space and in the xiphoid bone of the sternum. And the principle is the same for the pelvic diaphragm. It's an indirect technique in which we can obtain a relaxation of the tissues between the two hands using an indirect way of treatment. The last diaphragm we can treat in the first technique is the upper thoracic diaphragm. We can gently put the hands between the upper thorax, T1 and T2 and T3, and the other hand on the upper part of the sternum. And we can apply a gentle compression as for the other diaphragms to obtain a relaxation of the tissues between the two hands. The way of the treatment is indirect and it lasts as for the other diaphragms 2 or 3 minutes or until the tissues has been relaxed. The second technique used in this paper and this case report is a harmonic technique that is involved for the treatment of the diaphragm. The diaphragms treated are the same of the first technique, but in this case it's not an indirect technique but a harmonic technique we used for this treatment. The first diaphragm treated by this harmonic technique is the pelvic diaphragm. We put our hand on the iliac bone and the movement lasts for 2-3 minutes in this way. The frequency of the movement is really gently to obtain a good relaxation of the articulation and of the tissues. The second diaphragm treat with harmonic technique is the respiratory diaphragm. The technique lasts 2 or 3 minutes of harmonic movement in this way. The last diaphragm is the thoracic diaphragm. The hands are put on the clavicle and on the shoulder to obtain an harmonic movement on the upper thoracic diaphragm. Also, this treatment lasts 2 or 3 minutes or until the tissues has been relaxed. The third technique used in this case report is the relaxation of the suboccipital muscles. This technique is performed using the forefinger. We put the forefinger under the occiput bone and we keep the head lift up from the bed. We keep this position and these pressures on the suboccipital muscles for 3 or 4 minutes until the muscles has been relaxed. The fourth technique is the mandibular lift. In this technique, it's important to relax the TMJ articulation. You can put our hands gently on the mandibular branch and we can perform a gently lift off of the mandibular bone. This can lead a traction in an anterior way of the TMJ. You can keep this position and this technique for some minutes, 3 or 4 specifically, until we can have the relaxation of the TMJ. The fifth technique used in this paper is the treatment of the sphenopalatine ganglion. We can find the sphenopalatine ganglion behind the zygomatic bone. We can follow all the upper jaw with our fifth finger of the hand, and then going up we can find a sort of little hole in which we can find the starting of the sphenopalatine fossa. We follow all the upper jaw and then up. Here we can treat with a sort of slow and gently massage the size of the sphenopalatine ganglion. The technique can be performed for 2 or 3 minutes or until we can see sort of tiring of the eye of the patient, ipsilateral of the technique. This is a sign of the stimulation of the sphenopalatine ganglion.